Good morning and regards to all. My name is Dr. Anand. Good evening, everyone. How's everyone doing? I hope you guys are doing great. Good morning, good morning, good morning, good morning. आज शुरू करते हैं अगली क्लास हमारी. Is my voice audible to everyone? Please let me know. Good morning. This is the most amazing 5:30 a.m. series we have. UPSC questions part 7. Soon we are finishing the UPSC series and we're gonna start off with the what we call the PLAB series also. The main overseas exams are the thought of choice now. So we have this PLAB series, we have the MRCP CS series. Right now we have the UPSC series. So is my voice coming to everyone? Please let me know in the comment section. I think yes, it is coming. Great. Let's start off this class. Good evening and regards to all. हाँ जी, कौन कौन आए हैं? मैं ज़रा जल्दी से उनके नाम बोल दूँ अपने प्यारे प्यारे श्रोता का. Good morning. Good morning, Shreya. Good morning, Pradeep. Good morning, Ramu. And good morning, Shreya Krishna. I hope the voice is coming. Let's start off this class. 15 minutes. Just give it to me. Let's enrich some good amount of knowledge. My name is Dr. Anand and today's topic of choice is UPSC Part 7. Before starting any segment, we always have a quote. And what is the beautiful quote for today? The beautiful quote for today we have is balance is not something you find. It's something you create. Very nice thought process this is. Balance is not something you find. I'm not getting time to go to gym. I'm not getting time to manage my life. I'm not getting this. I'm not getting that. I wish I had time. I wish I had this. So instead of wishing, regretting and saying this and that, balance is not something you find. It's something you create. Okay, simple logic, simple thought process. Remember that. Okay, balance is something you don't find, you create. This is your life, right? No one else. So it's your duty to make it beautiful. No, God is not kind with me. So don't give that halat wali line. Okay, that won't work actually. So balance you create by yourself. Okay, it's something you create. So think about it. Okay, think about it. Next question. A 10-month-old child with respiratory rate 64 and refusal to feed. According to the IMNCI guidelines, what do you think which category the patient comes into? So what's the best answer for this question? Any idea? Which category the patient is coming into? What will you write in exams? Yes, exactly. So any idea? Yes, very good. Shreya, Pradeep, Shreya again. Kamal, good morning. So I hope this is coming. Is my voice coming to everyone? I hope it is coming. Is the video buffering? I hope it is buffering. Okay, great. So what is the best answer for this question? Who will tell me? Yes, very good, very good. So what is the best answer? So what is pneumonia and what is severe pneumonia? So we have a 10-month-old baby who has this respiratory rate 64 and refusal to feed. So what is pneumonia and what is severe pneumonia? Yes, exactly. We all know that. Fast breathing. Yes, very good. What is pneumonia? Fast breathing with or without chest indrawing. Fast breathing with or without chest indrawing is known as pneumonia. Fast breathing with or without chest indrawing is known as pneumonia. If there are danger signs, that is known as severe pneumonia. Yes, very good, very good. That's right. Perfect. Okay. Yes, good morning to all the beautiful people. Hi, Sakshi. What's the best answer? What do you think? Yes, Sakshi is right. Pradeep also is right. Very good, very good. So what is the best answer for this? So what is pneumonia and what is severe pneumonia? So fast breathing with or without chest indrawing is known as pneumonia. Number one, is the patient having fast breathing? 10 months old baby, respiratory rate 64. What do you think? What is the cutoff for fast breathing? So we have 0 to 2 months, 3 months to 1 year, 1 year to 5 year, and more than 5 year. This is the age wise cutoff for the respiratory rate. If the respiratory rate is more than 60, 50, 40, 20, these are the RR cutoff we have in a case of pneumonia. Yes, Shreya has the best answer. Pradeep has the best answer. So very importantly, yes, fast breathing with or without chest indrawing is known as pneumonia. So the 10 months old baby having RR 64. So 10 months old baby having RR more than 50 is the cutoff for tachypnea. So yes, the RR more than 64. Yes, I think I can say the patient is having fast breathing. And refusal to feed. Doctor, baby doodh nahi pee raha. Now refusal to feed is a danger sign. Exactly. Refusal to feed is a danger sign. That's very well put. Beautiful. Told by Sakshi, Kamal, Shreya and Pradeep. So yeah, so fast breathing with or without chest indrawing is known as pneumonia. And what's the treatment for pneumonia? The treatment for pneumonia is amoxicillin for 5 days. Amoxicillin for 5 days. And if the patient has danger signs like refusal to feed, like the patient is having seizure, like the patient is having lethargy, so this is known as severe pneumonia. So the best answer for this question is severe pneumonia. And what is the treatment for severe pneumonia? The treatment for severe pneumonia we we have is, any idea? Yes, that is ampicillin and gentamicin. Ampicillin and gentamicin. This is the treatment for pneumonia. So that covers a very important questions for INICT, NEET PG, FMG as well as for UPSC. Next question. 5 questions back to back. Very good. Which of the following is the best strategy to use in the management of temper tantrums in a 3-year-old boy? Temper tantrums, we know it's one of the kind of a behavioral disorder like food fussiness, nocturnal enuresis. So there are a lot of behavioral disorders जो 2 साल से 5 साल के बच्चों में देखे जाते हैं, and temper tantrums is one of them. So what is the best answer for this question? Yes, what do you think? Sakshi, what do you think? That's right. Shreya, Pradeep, Kamal, yes, very good. What's the best answer for this question? Yes, very important. Please remember that the best answer for this question we have is timeout. Okay, obviously you will not scold the child, obviously you will not punish the child. Giving in it demands, no, don't make him hyperactive. उसकी सारी बातें नहीं माननी बच्चे की. You don't have to fulfill all his demands, but definitely yes, you have to what we call timeout बोले तो timeout means like as in like whatever he's doing, just make sure that he's not hurting himself, like just leave him at that point, and that is known as timeout. उसे छोड़ दो, कुछ मत करो, तंग मत करो, उसे छोड़ दो, and he will be fine. Yes, perfect. But that's the right answer. Yes. Yes, my dear Teja, in the severe pneumonia, the patient will be, doctor, my baby is not feeding well, doctor, my baby will have seizures, and doctor, my baby is having lethargy. So these are like the seizure, lethargy, shock-like state. These are the danger signs, and that you admit the patient and you give ampicillin and gentamicin. So the best answer, a good question we have is behavioral disorder, and the best answer is timeout. उसको छोड़ दो उस time के लिए. Next question. 10-year-old child came with difficulty in word recognition, word decoding abilities, and difficulty in spelling. Yes, exactly. Tare Zameen par baby, what was he suffering from? So difficulty in spelling. If someone is having difficulty in spelling, what do you think? Kamal, Shreya, Gauda, Indi, Varli, and again Pradeep Puri. What is the best answer for this question? Is it an autistic spectrum disorder? Autistic spectrum disorder, the patient will be inattentive. The patient will be impulsive, okay, and the patient will have a stereotypical pattern. So this question doesn't look like a inattentive, impulsive and stereotypical pattern. He has a problem with the spelling or problem with the word problem. बार word आ रहा है, word का आ रहा है और spelling का आ रहा है. So the best answer for this question is dyslexia. This is actually dyslexia, you know. You should always remember dyslexia, like difficulty in expressing himself in writing and making frequent spelling mistakes points toward a diagnosis of dyslexia. See, my classes like short and sweet, like whatever you're reading, tell yourself you're reading for the first and last time. पहली और आखिरी बार पढ़ रहे हैं, ऐसे करके चलो, ठीक है? So then the life will make much sense. You got this question for the once you tell yourself, no, see, it's very important. Once you tell yourself, I'm reading this for the last time, you're all salkai ghaira, your brain, everything come back to center. Once you say no, I will revise it later. No, tomorrow also I'll read it. No, I'll watch this video now, then I'll watch it again also. Then your mind, half he will listen and half he will leave. So you are reading this for the first and last time, and if you get an MCQ of dyslexia, the problem, very important, is the word. There will be a lot of spelling mistakes, difficulty in expressing himself in writing, somewhere writing and somewhere spelling mistakes. If you talk about, the best answer for this question is dyslexia, that you should know. If I ask you one more question also, 14-year-old boy has a difficulty in expressing himself in writing and making frequent, same thing. See, same problem. I wanted to show you one more question which came in AIM exam before also and came in UPSC paper also. All the papers are like coinciding. So spelling mistakes, if a child Tare Zameen par do spelling mistakes, he's so beautiful, he wrote dyslexia but in a different manner. Can you see that? So he does not follow the instructions and cannot wait for his turn while playing a game. But the problem is spelling. So definitely, you know, the best answer for this question was actually dyslexia, very importantly. This is nice. Achha, what do you think? What is the answer for this question very importantly? Is this mental retardation? ठीक है, हाँ. Don't worry, Strait syndrome I also don't know क्योंकि वो कुछ होता ही नहीं है. There's nothing known as Strait syndrome. Okay, so yes, exactly. So what is the answer for this question, guys? A, B, C, D. Previous question, okay, fine. The answer was dyslexia. What is the answer for this question? It's a random question I put of AIMS paper. Mental, is it mental retardation? First of all, mental retardation, that word itself is not used. It is intellectual disability. Is it a lack of interest in studies? Is it examination anxiety, or is it a specific learning disability? The best answer for this question is a specific learning disability, and that is known as dyslexia. That's what. Okay, very good. Next question, please. And very importantly, autism or autistic spectrum disorders. See, this is the child of autism. Okay, this is autism. The child will be totally aloof. See, that's a very beautiful description of a child with autism. He's, even though he's inattentive, impulsive, and have a stereotypical pattern, but he'll have a impaired neurobehavioral development and impaired social interaction. Yeah, no problem, dear. And so this is a child of autism. Okay, look at the picture. He's being, he's inside a small box. So that is very sad. Next question. The protective efficacy of hepatitis immunoglobulin if the baby is exposed to Hep B positive mother is what? Very beautiful question. We know, right? If the mother is hepatitis B positive, what do you give to a baby or a newborn? To a newborn, you will give hepatitis B immunoglobulin on one thigh and hepatitis B vaccine on the other thigh, right? One vaccine you will give and one immunoglobulin you will give. So, but the question is that ये फायदा कितना करता है? How much is it's gonna be helpful? This injection is very expensive. We tell the family to get this injection as soon as possible. It's an expensive injection. It's very important for your baby. In Hindi we say कि बच्चे को काला पीलिया से बचाता है and all that. So what is the best answer? Yes, very good. So what do you think? In the very wrinkle, we have Kamal Sharma, Shreya Krishna, Teja Gowda, Pradeep. Yes, what do you think? Hanji, perfect. What's the best answer for this question? A, B, C, D? Okay, fine. In the really says that C is the best answer. See, even though, remember always now, okay, even though this is the very expensive injection, but it gives the only 10 to 30% of active immunity. 70% immunity will be given by the vaccine, and just to cover up that 10 to 30% of immunity, I'm telling the father to get the injection. So this is something you need to know. Okay, so the protective efficacy of hepatitis B immunoglobulin, it basically helpful. The efficacy is 10 to 30%, and this one vaccine is 70%. But you're talking about immunoglobulin, जो महंगा इंजेक्शन आप ला रहे हो वो 10 to 30% ही efficacy देगा. Whatever the expensive injection you're getting, it will give you 10 to 30% of efficacy. Remember that. Okay, it's an important question. Again, same FMG, NEET PG, and UPSC question. Last question, very nice question actually. FIPV, fractional inactivated polio vaccine, and IPV. See, we call it IPV first of all. Many people, what is IPV? First of all, many students say it is injectable polio vaccine. Bhagwan, please, for God's sake, remember, even though it is given injectable, remember, tell the examiner inactivated polio vaccine. And now you say FIPV, like a reduced or smaller dose. So fractional inactivated polio vaccine, and so longer they have written fractional inactivated intradermal polio vaccine, which is fine. It is given at which age according to the national immunization schedule? Yes, Pradeep, there is no specific thing of months, as in, right now for the newborn baby approach, this much will remember. Apart from this, there's a separate whole chapter where we talk about the infectivity, HBeAg and everything. वो तो पूरा एक ग्राफ है जो मुझे याद दिला देना, हम बाद में डिस्कस कर लेंगे. हाँ जी, what is the best? Yeah, very good. Wrinkle, Kamal Sharma and Shreya Krishna, beautiful answer. So remember FIPV, this is a very latest question actually. Most of us don't know about it. Remember, okay, so if I zoom, we can't zoom this picture right now. Wait, let me zoom it for you because I want to show you. This is our hospital vaccination card. Okay, kahan chala gaya? Yeah, this is our hospital vaccination card, and if you can make out that much, okay, only I can zoom it for you. So if you can make out right now, my dear family, so this one, now look at this. Here it's written FIPV. Can we appreciate this picture? Yes or no? Here it is written FIPV, remember. So 1.5 mahine pe this is written 1.5 month, we give FIPV1, and see, 3.5 months we will give FIPV2. So FIPV1 and FIPV2, remember, this is something you need to know. Okay, even though it's darker, so I'm just telling you now only. At 1.5 mahine pe or 3.5 mahine pe FIPV लगता है 1 and 2. By 1.5 month and then by 3.5 months of the age, we give FIPV1 and FIPV2. Okay, it means 6 weeks and 14 weeks. This is a very important, this seriously, it's like a very important, let me zoom it properly. This is a very important graph. Examiner itne question पूछता है इससे. Examiner asks so many questions, my dear friends. Okay, let me just zoom it for you. Okay, this is the maximum we're able to zoom. Okay, Yeah. Now listen very carefully. 6 weeks, 10 weeks, 14 weeks. Let's learn something right now over here. 6 weeks, 10 weeks, 14 weeks means 1.5 month, 2.5 month, 3.5 month. 6 weeks, 10 weeks, 14 weeks. The best question we have it over here is what all vaccines are parallelly coming. So we have Penta 1, Penta 2, Penta 3. So remember very importantly, so PRO, okay, PRO, premature rupture of membrane. Can you remember PROM? Yes or no? So P for Penta 1, 2, 3, R for Rota 1, 2, 3, O for OPV 1, 2, 3. So very beautiful question, guys. Please appreciate this. 6 weeks, 10 weeks, 14 weeks. If examiner asks you, tell me the immunization schedule, at least you can say 6 weeks, 10 weeks, 14 weeks. Remember PROM, premature rupture of membrane, PROM. P for Penta 1, 2, 3, R O for PROM, R for Rota 1, 2, 3, and O for OPV 1, 2, 3. Okay, PRO. This is 6 weeks, 10 weeks, and 14 weeks. Now there are two things which is only 6 weeks and 14 weeks. 6 weeks and 14 weeks. That is PCV 1 and 2 and FIPV 1 and 2. Remember PP, दोनों में PP आ रहा है. PCV and FIPV both have PP. Okay, yeah. So premature rupture of membrane was over, and one more P is there, PP. P for PCV 1 and PCV 2, and FIPV 1 and FIPV 2. This is really important. Yes, my dear Shreya, very beautiful. Shreya has told that yes, PRO 6, 10, 14. This is important. Are you understanding? Yes or no? This is an important question. Please appreciate this. Okay. So yeah, बहुत सारे questions यहाँ पे हो जाते हैं. So I'll repeat again. 6 weeks, 10 weeks, 14 weeks. PRO 1, PRO 2, PRO 3, and then we have PP, that is PCV. That will be 6 weeks and 14 weeks, and FIPV 6 weeks and 14 weeks. So the best answer for this question, let's go back to the question now. So the question we are starting over here is this one. Yes, when do you give fractional IPV? The best answer is it is given at 6 weeks and 14 weeks. Yes, so this is the best answer, 6 weeks and 14 weeks. That's it. That finishes this class. Let's have a quick back-to-back revision what we spoke about it. This was the UPSC CMS question part 7. All the parts are there in my Pediatrics by Dr. Anand app. Just you have to go to Play Store and just type and you'll get the app. In this class I've got an idea that balance is not something you find. Balance is something you create. Then also in this class I got about the pneumonia and severe pneumonia. Fast breathing with or without chest indrawing is known as pneumonia, and if there are danger signs, that is known as severe pneumonia. And in this question, refusal to feed definitely is a danger sign. Then also I got an idea that if someone having a temper tantrums, food fussiness, or bacha behavioral disorder, basically time out, usko akela chhod do, leave him alone. Time out is a very good option. Then also I got an idea that someone talking about word difficulty in word or spelling, you have to see in every MCQ you have to pick up the highlighter, my dear family. Okay, very good. Shreya, Shakti, Indi, Niharika, and again Teja Goda and Wrinkle, very good. So words, I think we are talking about dyslexia. Here also spelling mistakes, writing mistakes, words, difficulty in expressing himself. Same Tare Zameen Par he was able to difficult to express himself. So again, very importantly, it is a specific learning disability. Then also in this class I've got an idea that hepatitis B immunoglobulin which I give to my child has 10 to 30% of efficacy, and around 70% efficacy has of hepatitis B vaccine. Then also I've got an idea that this is a very beautiful question that I've got, that fractional IPV and fractional IPV is given 6 weeks and 14 weeks, and PCV also 1 and 2 is given 6 weeks and 14 weeks. This is so important. So that's it. That finishes this class. Has everyone understood? Yes or yes. This was a quick happy 15 minutes back-to-back class of UPSC part 7. Before leaving, we always have a quote, and the quote we have is, you are the artist of your own life. Don't hand the paintbrush to someone else. This is such a simple and a beautiful quote. No sir, I don't get angry. She made me angry. No sir, I don't get offended. They made me offended. No sir, I don't like anything. They commented, so I got hurt. They told. So they. There are 1 crore million people who gonna poke you. So how will you breathe when you get poked by every single Tom, Dick, and Harry? So what is the moral? The moral is you are the artist of your own life. Don't hand the paintbrush to anyone else. Life is beautiful. Make it beautiful. Create the balance. No, God did this to me. No, don't be that cribbing soul. You will never be happy. You will get to know once you become bigger by age and experience. You will get to know it is all about peace of mind. It is all about not commenting on anyone. It is all about working on oneself. It is all about not criticizing God, parents, family, people around you. They poke me, they hurt me. No, it's me, and me. let me make it myself beautiful. That's it. Okay, so thank you so much everyone that sign out this session. I hope you guys have got some knowledge, and that's it. See you around here and there in life, and till then, bye bye.